Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay, 20% of patients with colorectal liver metastasis are the candidates for curative liver resection. So, among 20% of patients can undergo liver resection, and among those 20% of patients who have undergone liver resection, they have a 5-year survival rate of around 25 to 58%. So these patients will have a 5-year survival rate of around 25 to 58%, and among them actually two-thirds of the cases will recur. But in high risk situations, that is if the patient is of high risk, like if the patient has 4 or more tumors, or if the patient has an extra hepatic disease, in them the recurrence rate is more. If the patient has 4 or more tumors, or if the patient has extra hepatic disease, then the recurrence rate is almost more than 80% or more, right? So normally there is only two-third cases will recur, but in higher risk conditions, like if there is 4 or more tumors, or if there is extra hepatic disease, then the recurrence rate is around 80%. Then okay, whenever we do an extra hepatic resection, right, whenever we do an extra hepatic resection, we can do extra hepatic resection also in this liver metastasis. So extra hepatic resection actually with best outcome, extra hepatic resections with best outcomes are, so what are the extrahepatic resections with best outcomes? Like if you do a limited lung resection along with this, or if you do a loco-regional metastasis resection or portal lymph node resection. So limited lung resection or resection of loco-regional recurrences of primary tumor, or if you do a portal lymph node resection, so these are the resections with better outcome along with extrahepatic metastasis. If the in these extrahepatic metastasis in the lungs or loco-regional recurrences or portal hypertension, so these are portal lymph nodes, these are associated with better recurrences. Right. One more important thing. I said there are recurrences are seen in two-thirds of the cases if normally, and if there is high risk situation, then recurrence rate is more than 50%. But among these recurrences, half of the recurrences, almost half of the recurrences in the liver, and almost other 5% of these of the recurrences, so these patients can have actually the half of the recurrences which are isolated in the liver. These patients we can also do secondary liver resection also. Okay, in almost half of the recurrences which are present only in the liver, if they are present only in the liver, then we can do a secondary liver resection, and then we can expect again the 5-year survival rate to be 30 to 40%. Then, if the patient has a synchronous liver metastasis, then in such cases, if the patient has synchronous liver metastasis, that is when there is association with poorer prognosis.
thank you and thank you for watching.